Hi guys, hope you're doing well. My name is Dr. Zakir Hussain. I'm one of the tutors here at UKPass Academy. Today I'm just going to give you a few tips about interpersonal skills and how to improve them for the PLAB 2 exam. So my first tip would be that whenever you begin your consultation with a patient, that always try to maintain a professional but friendly tone. So maintain politeness always, but remember that you're not the patient's friend, you're the patient's doctor. So you have to maintain a professional approach, but ask them questions like how your day is going, and just to try and ease the situation. Remember, patients, when they turn up at the hospitals and things, they're very anxious, very nervous. So remember, your scenario is around the same type of situation. The patient is going to be like how they would be in the hospital. They might be a bit anxious, they might be a bit nervous. So the first person they're going to meet is going to be you. So your tone, your approach, everything will help put the patient at ease. The second advice I would give you is that your language, make sure that the jargon that you're using is at the level of the patient. So if, for example, you have a patient and they have some sort of infectious process, don't start using technical medical terminologies and things that the patient won't be able to understand. It might lead to the patient just becoming confused, or it might worsen the anxiety even more. So cater your language, cater your jargon to the level of the patient. Try to avoid using technical terminologies and things like that. And the third tip is a bit specific, but it's for scenarios where you have to break bad news. Remember, in these types of scenarios, you need to take a very empathetic approach and a very empathetic tone with the conversation that you're having with the patient. And one thing is to stick with the spikes protocol, but remember, when you reach around the knowledge part of the protocol, that let the patient guide the conversation. Don't avoid trying to interrupt them, avoid bombarding them with a lot of information. Rather just explain and then listen. And then when you see that the patient's ready for more information, then proceed. Other than that, I would say maintain a very empathetic approach in those scenarios, and like I said, let the patient guide the conversation.